We have a confirmed case of measles in Hudson County. It is prompting public health alerts for commuters in Bayonne, Jersey City, and Hoboken. Health authorities confirm this is the seventh case in New Jersey so far this year, matching the total from 2024 and possibly signaling a resurgence if not managed swiftly. Measles is very catchy because the virus sits and lives for a long time. That's the problem. This morning, to contextualize everything, I love who our producer who wrote that, to contextualize. You're testing my verbal abilities and how concerned viewers should be. Dr. Steve Goldberg, Chief Medical Officer at HealthTrackRx, the nation's leading infectious disease laboratory. Doc, how do you like this? They're writing contextualize. I can't even say cat at 8:20 in the morning, and they're writing contextualized in my teleprompter. I love it. But good morning to you. Good to have you on, Dr. Goldberg.
Good to be with you, Ken.
So measles is a very serious thing because the virus, if somebody comes around and coughs or something with measles, doesn't the virus sit around and live for quite a while?
You're absolutely right, Ken. It can sit in the air for about 2 hours after someone with the infection coughs, and that's a problem. It's also very, very contagious. So if you're not immunized and someone near you has the infection and coughs, you've got a 90% chance of getting the infection. It's highly contagious, and that's a problem with the disease.
I had no idea it was that. I knew it was contagious, but that's amazing. And it's interesting that I literally went to pick up a prescription at my local pharmacy the other day. And among the things they asked me was, would you like to schedule for your flu shot? And then they added, do you want to schedule an MMR vaccine? Which I thought was interesting because I live in a county not far from this area. Um, I'm 58. I would have had an MMR shot, I guess, as a baby. How long does that last, and should adults consider getting another shot?
Yeah, adults should consider getting another shot. Certainly, if you're immunocompromised, certainly, if you're concerned that your measles protection is waned off. There are a couple ways to check. One is to get a blood test to see if you still have antibodies. If you don't have any underlying condition, the easiest thing to do is simply go get a single measles shot.
And most health insurances cover it. It doesn't hurt. It takes a second. You could walk into your most supermarkets that have a pharmacy, right? The most CVS's and Walgreens. It's easier to make an appointment online, but you could just walk in. If it's not a busy time, they'll sit you down. It takes a couple of minutes. And just for the peace of mind of knowing that you're protected, it should say it all. How serious is getting measles for an older person versus for a younger person who's in good shape?
It is serious. They're more likely to have life-threatening problems with it, and they include serious respiratory infection, end organ injury, and frankly, even death. The very young who haven't gotten immunized and the very old who are likely immunocompromised and also have waning immunity are the two groups, and also pregnant women who might not be immunized are at the highest risk.
And do we know much about this particular measles case in Hudson County? Are you familiar with any details on this, doctor?
Yeah, I've been following it and checked as early as this morning. So the health department reported that an individual with active measles was riding in trains in New Jersey sometime between the 13th and 15th and got identified and is getting evaluated. Their information is certainly private. What we do know is they've not had any identified contacts with anybody who's not been immunized. So there's no evidence of, if you will, a spread or an outbreak linked to this case.
Thankfully. I just want to clarify, as you just pointed out, it was in New Jersey. This is from the New Jersey Department of Health. And just to clarify for everybody, so they're aware of where this happened and the dates. So apparently the individual, and it's not their fault per se, because they didn't may not have realized at that point they were infected, but and wisely they knew where they went, which was this is a great help. So they were at the NJ Transit Hudson Bergen Light Rail 8th Street, Bayonne to Hoboken branch, August 13th, 14th, and 15th, between 9 a.m. and 11:30 a.m., and between 6 p.m. and 9 p.m. So if, oh, and they were also at the 8th Street Light Rail Station in Bayonne, those same times, Path Newark, World Trade Center line, and Exchange Place Station, Jersey City. So on those dates, 13th, 14th, 15th, if you were at any of those locations, you didn't have to be in direct contact, right? That person could have been walking through. That's all they needed to do. And that virus sits in the air a few hours and you could have been exposed. So just beware. And what is the rule now? If you think you were exposed, it could take up until I think September 11th before symptoms show up, right?
It's 10 to 14 days after an exposure before you might show symptoms. So you have to keep that in mind. We're almost at the end of the interval of someone who wasn't immunized contacting this person and being concerned. But in general, if you've got fever, you're feeling ill, red eyes, and are starting to develop a rash, just talk with your clinician. It's an easy way to figure out best next steps.
And the good news about HealthTrackRx, thankfully your company does exist, is that instead of submitting a test and waiting 3 or 4 days with HealthTrackRx, they submit that test the next day. The results are out so that you don't have to keep somebody isolated if it turns out they don't have measles. You don't have to keep them locked in their home for 3 or 4 days. By the next morning, they know, right? So you provide urgent care centers, hospitals, doctors' offices, et cetera, these test kits. Talk about that.
Yes, we're the largest provider of outpatient infectious disease testing in the United States. We are able to provide clinicians with a result the next morning because of a strategic relationship with UPS. So our tests are picked up overall about 4 p.m. anywhere in the continental United States, flown to our main lab in Louisville. Team works overnight and results it out the next morning. And clinicians say that information helps them make right decisions the first time, and also for other infections are more selective with use of antibiotics. Antibiotic resistance is a big problem in the United States.
Because everybody thinks that no matter what their respiratory illness, that an antibiotic will knock it out. If it's viral, an antibiotic does nothing except potentially cause antibiotic resistant strains of bacteria to form, correct?
Exactly, Ken. And sadly, for respiratory complaints, antibiotics are overprescribed about 50% of the time. And that has led to more and more antibiotics not working for people with infections. So it's a real problem. So getting the right diagnosis first is a good way to make sure you get better faster.
Yeah, and I know I've traveled to Europe, I've traveled to the Caribbean. There are a lot of places on the planet where you don't even need a script for antibiotics for most of them, not all of them, but most of them, right? Where you can get them off the shelf. And the good news is that in many cases, the pharmacist is a doctor of pharmacy and can kind of guide you one way or the other in those places. But the bad news is that all too often they just say, here, take some antibiotics. And so with that around the world, I'm sure that hasn't helped issues.
It hasn't helped issues. And worldwide, antibiotic resistance is tracking to be the leading cause of death worldwide by 2050. So it's a real worldwide problem. In the United States, to your point, we have to have a prescription from a clinician in order to access antibiotics. That's helpful. And then early testing, getting a right diagnosis, also helps the judicious or careful use of antibiotics by clinicians.
Well, what a difference HealthTrackRx makes because of the speed of getting this information. What's the website for HealthTrackRx, doctor?
www.healthtracksrx.com, Ken.
So there you go. So it's www.healthtrackrx.com. Dr. Steve Goldberg, Chief Medical Officer at HealthTrackRx. And just so that people who, because we talk about this a lot, and I'm fascinated by this, very basic but brilliant idea. They have the lab at the airport in Louisville. So when the UPS planes come in, it's not like they sit at the airport for 6 months and then they make their way across town. And then when somebody gets around to it, they test. No, it literally comes off the plane at the lab, at the airport. The test results come in, it goes into a computer. Your doctor knows next morning. That's brilliant. Like, why hasn't this been thought of? But thankfully, you guys thought of it first, I guess, and made it work. And you really help clinicians all over the country make proper diagnoses. Dr. Steve Goldberg, Chief Medical Officer at HealthTrackRx. Thank you so much. It's always a pleasure to have you on, Doc.
Thank you, Ken. Have a great day.